With respect to the robot and how it invades or does not invade the patient, the robot is not actually in the patient. Traditional laparoscopy involves placing access to the abdominal cavity in the form of basically some plastic tubes. And in traditional laparoscopy, we then place our instruments through the tubes to do the surgery, whether it's an instrument that grabs, cauterizes, cuts, staples, whatever we're doing. Those instruments go through these plastic tubes actually into the patient, again, where the target organ is of whatever our operation of choice at that time is. The Da Vinci robot system is exactly the same. We still have instruments inserted inside the patient. The robot itself is not inserted inside the patient. The robot is the equivalent of my hands, where the instruments, instead of being in my hands and being directed by my hands, they're attached to the robot, and then I'm telling the robot what to do with my hands via a console. The enhancement that gives you, again, is not only better vision, but the robot actually has the ability to have its fine motor movement dialed up and dialed down. So there may be certain portions of the procedure where I would like my gross hand movement to be a little bit more refined. And I can dial that down to where this much of a turn of my hand ends up being a tiny fraction of that on the robot. And that can be dialed up to, depending on how delicate of an area of the body you're operating. So it's still my movements, and it's still the same equipment used in traditional laparoscopy, but with the ability to refine the movement as needed and as the case requires.